Dear students, this is the video on histology of blood vessels. The basic structure of a blood vessel is histologically it is made up of three layers. The innermost layer is the tunica intima, which is made up of endothelium. The endothelium is formed by simple squamous epithelium lying over the basal lamina or the basement membrane. Deep to this basal lamina, there will be a layer of loose areolar connective tissue which forms the subendothelial connective tissue or the lamina propria. The tunica intima is limited outside by the internal elastic lamina, which is made up of elastic fibers, and the lamina is fenestrated. The second layer is the tunica media, which contains concentrically arranged smooth muscle fibers, elastic and reticular fibers. This layer is limited outside by the external elastic lamina, which is again made up of elastic fibers, and it is fenestrated. The outer layer is the tunica adventitia, which contains mainly the longitudinally arranged collagen fibers with few reticular fibers. So this is the diagram showing the basic structure of a blood vessel. You can see the tunica intima consists of endothelium lying over the basement membrane, the subendothelial connective tissue limited by the internal elastic lamina. The next layer is the tunica media containing the smooth muscle fibers and elastic fibers limited by the external elastic lamina. The last layer, that is the outer layer, is the tunica adventitia, which contains mainly the collagen fibers. In this layer there will be plexus of blood vessels, small blood vessels supplying the blood vessel wall of a large vessel, and these vessels are called as vasa vasorum. The autonomic nerves which are supplying the wall of the blood vessel forms nervi vasorum. Coming to the elastic artery or the large sized artery. In this artery, the endothelium is formed by the simple squamous epithelium. The subendothelial layer contains collagen fibers and few smooth muscle fibers. This part forms the tunica intima, which is limited outside by the internal elastic lamina, which is made up of elastic fibers, and the layer will be fenestrated. The next layer is the tunica media. In the artery, that is in the elastic artery, the tunica media will be thick compared to the tunica adventitia, and it mainly contains the elastic fibers with few smooth muscle fibers which are arranged concentrically. The tunica media is limited outside by the external elastic lamina containing the elastic fibers. Since the tunica media contains large number of elastic fibers, the internal elastic lamina, which is made up of elastic fibers, is not prominently seen in the elastic artery. In the tunica adventitia, there will be collagen fibers, and in this layer there will be small blood vessel supplying the arterial wall called as vasa vasorum. The examples for elastic artery are aorta, subclavian artery, or common carotid artery. This is the slide of elastic artery under low power, where you can see the endothelium very close to that internal elastic lamina, which is not prominent. The tunica media, the thickness of tunica media is greater than the thickness of the tunica adventitia. The tunica media will be mainly containing the elastic fibers. The tunica adventitia will be containing the collagen fibers. The adventitial layer is containing with the external connective tissue which gives support to the elastic artery. Next is the muscular artery or the medium sized artery. As the elastic artery divides and redivides, the amount of elastic fibers in the tunica media decreases and the smooth muscle fibers increases. So in muscular artery, The endothelium is same, that is simple squamous epithelium. The subendothelial tissue contains the collagen fibers, and internal elastic lamina is made up of elastic fibers, and this layer is fenestrated. The tunica media, which is thick in the muscular artery, mainly contains the smooth muscle fibers with few elastic fibers which are arranged concentrically, and this tunica media is limited outside by the external elastic lamina, which is made up of elastic fibers, and this layer will be fenestrated. The tunica adventitia will be containing the collagen fibers, in which there will be small blood vessels supplying the wall of the artery called as vasa vasorum. So in muscular artery, two important points you should know: that the internal elastic lamina is very prominent, as the number of smooth muscle fibers in the tunica media are more, so it is prominently seen. So this is the slide of the muscular artery under low power, where you can see the internal elastic lamina, which is very prominent. The tunica media mainly contains the smooth muscle fibers which are concentrically arranged. The thickness of tunica media will be more in the artery compared to the tunica adventitia. So the tunica adventitia will be containing here the collagen fibers. Within this layer, you can see the small blood vessel supplying the wall of the artery called as vasa vasorum. And this tunica adventitia will be continuing with the external connective tissue, which gives the support to the artery. The next one is the large vein. So the difference between the artery and vein is, in the artery you have already seen that the tunica media thickness will be more and the adventitia will be thin, whereas in the vein the tunica media thickness is small, whereas the tunica adventitia thickness is more. And in the large vein, like inferior vena cava, the lining epithelium or the endothelium is simple squamous epithelium. Deep to that, there is a thin layer of subendothelial connective tissue. The tunica media thickness is small, and it contains a few smooth muscle fibers and collagen fibers which are arranged concentrically. The tunica adventitia will be very thick, which contains the collagen fibers as well as large number of bundles of smooth muscle fibers which run longitudinally. In this adventitial layer, you can make out small blood vessel which is supplying the wall of the vein called as vasa vasorum. The example for large vein is inferior vena cava. So this is the slide of large vein under low power. You can see the tunica intima here, very thin layer, then the tunica media containing the collagen fibers and smooth muscle fibers. The thickness of the tunica media is small compared to the thickness of the tunica adventitia. The tunica adventitia will be containing large number of bundles of smooth muscle fibers running longitudinally along with collagen fibers, and the outer layer is continuing with the external connective tissue which gives support to the large vein. Thank you.